What's up, you guys? Rener Gracie here with Dr. Gaetano Scuderi. We've known each other now for 20 plus years. And for those who don't know, we are both Jiu-Jitsu black belts. Most of you know that about me because I had no choice in this Gracie family. You're kicked onto the mat at a young age and you figure it out. But Dr. Scuderi has been training now for how many years?
Well, in Gracie Jiu-Jitsu, Brazilian Jiu-Jitsu, since 1994.
There you go.
After the second UFC.
And we met around 2002, give or take, and it's been an amazing relationship ever since, on and off the mat. And around 2014, something happened and you started working on something when it comes to osteoarthritis. Give us a little introduction as to what kind of spurred that interest in this field of study and where you ended up with APIC.
In January 2014, we received an FDA clearance letter for our autologous preparation of plasma that we use to concentrate alpha-2 macroglobulin so we can inject it into someone that has a painful joint, an arthritic joint.
And for the white belts, in terms of the science, explain what A2M or alpha-2 macroglobulin is for all of us.
Certainly. So alpha-2 macroglobulin, or A2M as it's known, because sometimes for some people it's difficult to say alpha-2 macroglobulin.
For me as well.
Yep. And so basically it's a protein, it's a plasma protein inside your plasma. So inside your blood, there's a water component that has a bunch of proteins, 600 plus or minus, and then a cellular component, red cells, white cells, and platelets. Those proteins have very specific roles in our body. And alpha-2 macroglobulin's role is to protect cartilage. And it really wasn't understood back when I was working on it. We had figured it out in the mid-2000s, late 2000s, and started working on this process. And we were able to figure out through taking somebody's blood, remove the cell component, and then through a filter process, we were able to super concentrate alpha-2 macroglobulin so we could deliver it into someone's joint, like someone with a knee injury.
And when they have a knee injury and associated osteoarthritis, what's happening in that joint that makes it to where the A2M is beneficial, and what's the relationship when A2M is injected into the joint?
So when someone has an injury to any joint, we're talking about the knee right now, but it could be any joint, including any of the joints in your spine, which are known as discs. Those joints are made of cartilage. They're special cells that have ability to kind of move around and absorb shocks and loads. And so when they get injured, they release these enzymes. It's almost like if you get injured or when a child is injured, they cry. So these tears that come out of these cartilage cells are enzymes, and they assist early on in the healing process with cleaning up an injured cartilage. So if you tore a little piece of your meniscus, they will go in and they'll clean that up. And if you have a small tear, sometimes you don't need a surgical procedure, it'll kind of heal on its own. But in many people, what happens is those cells, once they're injured, those cartilage cells, they continue to produce these enzymes even long after your body fixed it itself or a surgeon went in and cleaned that piece up.
Wow, so these enzymes are unhealthy for the joint because they're continuing to damage the cartilage after the injury and after the initial healing that was intended for it to be done. It keeps going, and is that essentially one of the root causes of osteoarthritis?
That's exactly the root cause. In most people it continues, but it should stop. Once the injury is over, the cells should just quiet down and go back to normal.
So where does A2M come into this equation now, and how does it help?
So the way the mechanism was made by nature, by our systems, is that for most of us, we would hope that once that injury happens, just like when you get an infection, right? When you get an infection in your body, the body recognizes there's a foreign body and it will recruit white blood cells to come and fight that infection. In patients that have injuries, alpha-2 macroglobulin will be made by the liver, and then it gets excreted by the liver in very high volumes. So the blood count, the concentration of it goes up inside your bloodstream. And so if you have an injury to your tendon or to the other parts of your body that are not in the joint, it can get there very easily. But in the joint, because of this tight saran wrap that wraps up all our joints, that keeps the cartilage and the tiny amount of the synovial fluid that keeps everything slick, so we have almost no friction. Sometimes you'll hear physicians talk about the slickness of an ice skating rink. Imagine walking onto an ice skating rink, how slippery it is when you try to stabilize yourself. Your joints are 1,000 times slicker than an ice skating rink. That's how amazing these cartilage cells are, how tightly they can be lined up, and the surface is almost frictionless. So you can have this beautiful motion. Once the cartilage is injured, when you have those divots, then it's not as smooth anymore. It's like a little pea in the bottom of your shoe type of thing. And so that will constantly be a source of irritation and production of these enzymes, these proteins that are inflammatory to the joint that also injure the cartilage and cause progressive loss of cartilage.
And the A2M, natural occurring A2M secreted by the liver, does it have trouble getting into the joints?
Yes.
Is that what you were referring to when you talk about the slickness and that sheet?
Yes. For many small molecules, it can go through by diffusion, right? We've all heard about diffusion, how things can move back and forth, but alpha-2 macroglobulin is a very large protein, and so it can't diffuse into the joint. It bumps up against it, it's like a wall. And so there actually has to be, it's called an active transport mechanism. There has to be a receiver there at the gate, like at the Emerald City, receiving you and opening those big doors to allow you to come in. And they can only get in one at a time. And it will open, take one, move across the cellular membrane, and then open back up on the other side and dump it into the joint. That's how it works. And so if you are one of the people like me, because I have bad arthritis, I don't have a lot of those little doors around my cells, my synovial cells in the saran wrap. So I can't get enough alpha-2 macroglobulin in fast enough into my joint. So once we figured this out, we developed a mechanism to concentrate it from our blood, because we know in people that are in pain, people that have arthritis, the alpha-2 macroglobulin levels actually go up in your bloodstream. So your body knows, hey, we need to make more of this stuff because Rener's right knee is injured. And if Rener is one of these genetically superior individuals that have a bunch more of these active transport mechanisms or doors around the synovial cells, they can open up, and then you don't need a supplemental injection. But for most people, they don't have that. So we figured this out, and we built a system to allow us to super concentrate it so a physician can just deliver it right into a diseased joint.